Hi guys, here comes your nutritionist again and with another exciting topic. I welcome you on board. I look forward to seeing this content help someone outside there for a better living and good health of the general population. So today's discussion is about a condition known as cerebral palsy. And we are drawing our discussion from research done by Sonthi 2018 and Daltas 2020. You are welcome. So cerebral palsy is a condition characterized by impaired movement and difficulty in maintaining posture and balance, as well as sensory deficits. And this condition has been associated with injury on the brain. However, ladies and gentlemen, it is not known clearly what causes the injury of the developing brain to an extent that this condition we are calling cerebral palsy comes in. However, researchers have established a number of risk factors that are associated with brain injury. Some of them include, number one, preterm birth. Another one also is perinatal infection. Another risk factor also is intrauterine growth restriction, among other risk factors. So when we talk about cerebral palsy, we are saying that the movement is impaired. In other words, there are three ways in which movements could be impaired. Number one, the child can have stiff muscles. In other words, the child cannot be able to move the hands or the neck or the legs. So their muscles are very stiff. Another way in which movement could be impaired is uncontrollable movement. The child now can just move the hands uncontrollably, or the legs uncontrollably, or the neck uncontrollably, because the muscles have uncontrollable movements. Another way of impaired movement is uncoordinated movement. You see, like when you are walking as a healthy person, the movement is coordinated. The way you lift your hands, the way you lift your leg, it occurs in a movement that is coordinated. But for a child or a patient who is suffering from cerebral palsy, the movements are uncoordinated. Maybe the child could be lifting the hand, yet the legs are still in a standing position. So such is what I'm calling uncoordinated movement. So this impaired movement can be either muscles are stiff, that means the child cannot move, or there is uncontrollable movement, or uncoordinated movement, or in other cases, it can even be a mixture of these three types of impaired movements. Ladies and gentlemen, cerebral palsy presents its signs and symptoms that I've mentioned in the years between 3 to 5 years of a child's growth time. So they may not show these kind of symptoms of impaired movements in the earlier stages of life. You may start seeing them as a parent or as a caretaker when this child is between 3 years to 5 years. In as much as I have said that cerebral palsy is characterized by impaired movements, as a result of this impaired movement, the child may also have other complications. For example, the hip bone may be dislocated, or the hand may not be able to function well. And also, besides those other complications, you may find that the child will also present with other conditions that are not directly as a result of impaired movement, but they are coming because of the problem in the muscle coordination and movement. For example, a child who has cerebral palsy may also have cognitive dysfunction, that is mental functioning. Things like memory, reasoning, understanding becomes difficult. This child also may present with seizures, and also this child may have ulcers, among others. And also they have other nutritional complications that come with this condition we are calling cerebral palsy. One of the nutritional complications is that the child may have constipation. They may have difficulty in passing stool. The stool becomes very hard and the child cannot pass it so easily. Another nutritional complication is vomiting. When they feed, they throw out the food. The food. Another thing is bowel obstruction. The movements of the food along the gastrointestinal tract or along the digestive system becomes difficult because there is bowel obstruction. Blockage. Obstruction is, in simple terms, blockage. So this child with cerebral palsy has also other complications. Some are nutritional, others are not nutritional. For those that are not nutritional, I've just mentioned, the example is cognitive dysfunction. The brain is not functioning well. The child cannot understand, reason, and all that. They cannot perform well in class and such stuff. And also those that are nutritional, I've said things like constipation, vomiting, and bowel obstruction. What is the dietary management for cerebral palsy? Number one important point is that the food you are giving a child or a patient with cerebral palsy should not be hard or stringy. In other words, the food should be soft. Remember, we have said that this child or this patient has problem in movement. So even the chewing, the swallowing is a problem. The turning of the food in the mouth is a problem because muscles are not coordinating well. Movement is limited and all that. So do not serve such a patient with food that is very hard, like nuts and all that stuff. Make sure the food is well cooked, it is soft, so that we enhance the ability of this child to break down that food. Number two, there must be a lot of fiber and fluid. Fluid are things like water, milk, porridge, fruit juices. And fiber comes from things like vegetables, fruits, and grains. Ensure such foods are plenty in the diet of such a patient, because fiber will help the food to go down the digestive system. Remember, one of the nutrition challenge or complication I have mentioned earlier on is that this patient may have problem like constipation. So just make sure that the food has a lot of fiber and you are giving plenty of fluids to ensure the food is able to move along the digestive system very well, so that also the stool will be soft and easy to come out. In that way, we shall be preventing or correcting the problem of constipation. Another important factor is that foods should be scheduled around the medication time. In other words, the interval between food and the time for taking medicine should not be so large, because some of those medicine, they cause stomach upset. So ensure that food is scheduled around the medication time. Maybe 15 minutes or 30 minutes before food or after food is when you give the medicine, just to avoid a problem of stomach upset. Another thing, the food should be in small quantities and distributed throughout the day. These children or these patients, usually they have poor appetite, and usually they feed very little because they are not able to chew food, they are not able to digest well, movements have been impaired. So we cannot say that you will just feed this person 3 times a day and you are sure they have gotten their daily nutrient requirements. No, you have to increase. Give small portion, but increase the frequency. Another thing, because this patient or this child usually has vomiting problem, make sure that the food also, you could give some water. They can sip water in between the food, or they can also take something like a citrus fruit like orange or what after taking the food, just to avoid being nauseated, which can eventually lead into vomiting. In some cases, especially in a hospitalized setting, tube feeding may be recommended, because there are situations where oral intake or eating through the mouth becomes really a problem. In that case, for us to achieve the daily nutrients that this child requires to have, we may have to go another extra step, and that is tube feeding. So the take-home message for that person, that parent, that caretaker who is having a child with cerebral palsy, make sure the foods are not hard. In other words, they should be very soft and easy to chew. Number 2, ensure the foods are scheduled along the medication time to avoid stomach upset. Then feed small frequent meals, because they are eating very little, and therefore we need to increase the frequency to ensure they get the daily nutrient that is recommended. Another thing, we are saying a lot of fluids to avoid the problem of constipation. A lot of fiber, and I've given you the sources of fiber. I've said fruits, vegetables, and grains. Make sure those things are in their diet to ensure digestion and bowel movement along the digestive system is occurring well. And in the event that the child has been hospitalized, then tube feeding may be recommended by the doctor and the nutritionist in charge. In conclusion, I want to say this to the caretakers outside there, the parents of children having cerebral palsy. This condition calls for patience, it calls for consistency. I have been in a hospital, and my fellow nutritionists, I can give a shout out to a few of them like Ruth, Millicent, and Esther, and one is called Calvin, that a parent comes to the child, you do the nutrition counseling, you do the recommendation, and then the next visit the parent comes, she has given up and she tells you, I did all those things that you told me, but the child is still the same. I want you to know that this is a condition that needs patience, it needs consistency, because remember, it occurred during development. Cerebral palsy occurs during development of the brain. That means even when the child was still in the womb. So it is something that will take time for these changes that we are talking about to come up. So I want to encourage parents, caregivers, do not lose hope. Be committed, be consistent in doing the right practices that we are recommending. Be patient and have that moral support to your child. I also want to appreciate all the nutritionists outside here that are going an extra mile to support these children, to do reviews to them, to plan for them, and all that. As far as dietary intake is concerned, we are doing a great work outside there, and I look forward to seeing things improve. I want to encourage parents. You need to support people, your families, you need to support such children so that we can see the change that is desired. That is enough for today. Thank you for watching. Remember to subscribe, remember to comment, remember to pose your question or your inquiry, and I will be here at your service. Till next time, shalom.